All right, so let's get after what you guys said were some of the lies that you were told in PT school. First one I want to cover is every patient needs a different treatment strategy, thought process, especially different patient populations and different diagnoses, which is completely wrong. So if we look at the wall behind me, so we've got a 7 or 8 time CrossFit Games champion with a knee problem, a swimmer, college swimmer with a shoulder problem, college football player, Heisman finalist who originally saw me with an ankle sprain. Then we go over here and we've got a club soccer player who had an ACL tear. We have Radio City Rocket who had a shoulder injury, NFL tight end with extreme plantar fasciitis problems. So all athletes, different sports, different diagnoses, different complaints, but they all came in for the same exact root cause of their problem. They all came in because they had neuromuscular inhibition. It's my job as a doctor to figure out where that inhibition is, reverse that inhibition. My thought process is the same for all of these patients. And when my Medicare patients come in and they have low back pain or a hip replacement or a shoulder impingement, it's the exact same thought process. We are treating human physiology, not symptoms. Now, if I treated symptoms and I chased symptoms all over the place, that would take me forever and my results would be crap because I missed the entire point, which is the root cause, which is neuromuscular facilitation and inhibition. So if you're having problems trying to assess, then treat, then progress your patients, notice I didn't say diagnose, I didn't say special tests, I didn't say differential diagnosis. Who cares what their diagnosis is? The root cause of their problem is the problem. Get to that. Stop dancing around pain and swelling and lack of range of motion. And is it bursitis or tendinitis or tendinosis or whatever. That's all garbage. And that's why you go down the road of symptom modification with cupping and needling. And do we do ice or do we do heat? Or do I do myofascial release or do I do stretching? That's all bullshit. And you know that's bullshit if you understand a scientific thought process that's based on human anatomy and biomechanics and physiology rather than patients' complaint of where their symptoms are, what their symptoms are. Who cares? If you chase symptoms with all of these people, you will chase symptoms for 2 visits a week for 6 to 8 weeks and get limited results. And when they leave, they're still going to be taping and wearing a brace and wearing orthotics and icing after everything and doing all their correctives and their mumbo jumbo stretches and Theragun and all that bullshit. If you get down to root cause, you might see them once a week for 3 weeks and they're completely better back to play and they're not doing all the crap that conventional physical therapists give them. So the lie that you were told in PT school was that everybody has needs to be treated differently per their diagnosis, per their activity level. It doesn't matter. My bet is everybody you're going to see this week, last week, and next week are all humans. And if you get down to root cause and you use human physiology, anatomy, biomechanics, you can't miss.